Some more analysis on that very issue Trudy was just discussing regarding the aged care workforce. Joining us live now is Ian Yates, the Chief Executive of the Council of Ageing Australia. Ian, appreciate your time. I will get to that aged care workforce issue in a moment. Today, though, to the news we've just learnt today, a third staff member testing positive to COVID at that Summit Care Aged Care Centre. Can you believe we're seeing this scenario unfold yet again in an aged care home? Have we learnt the lessons in this space or not?
Well, as I understand it, the third staff member is a close contact of the others, so perhaps that's not surprising, but it does seem, in terms of containing the outbreak, the operators are doing as well as they can, and the authorities are doing as well as they can. But let's hope that it doesn't spread further.
So where are we actually now in terms of the proportion of both residents, but also importantly those aged care workers who have been fully vaccinated? Are you comfortable with the pace that this is moving at?
No, we've not been comfortable with the pace in terms of the workforce for some time. There were difficulties early to do with supply and also medical advice about some of the issues of vaccinating at the same time staff and residents. And priority was given to residents, and we see the benefits of that. But we have been concerned for a long time that we didn't have enough strategies in place to get staff vaccinated, and we remain concerned. We need to really see every possible means used now to prioritise aged care staff. That can be government sending in teams, that can be providers utilising their connections with GPs. It can be providers organising for their staff to go to state government clinics. Most states are giving priority to aged care workers in terms of the queue, and it can be a range of those things. It can be aged care providers themselves arranging with the people who provide their flu vaccinations, for example, to set up a process for getting their staff vaccinated.
Well, you're right. I mean, it seems pretty obvious that the easier it is for this aged care workforce to get the jab, the better we'll do on that front. There is concerns that our reporter, Trudy McIntosh, was just outlining earlier about a section of the aged care workforce simply leaving, simply saying, this is all too hard, I don't want the jab, and I'm going to go and get a job at Bunnings. Is that the feedback you've been getting?
Look, we hear both that there are aged care workers who are looking for getting the vaccine, but there has always been a level of hesitancy. We fought for years to get flu vaccinations compulsory in residential aged care. That only happened last year. I mean, let's be really clear. Some people in the media have misinterpreted this. The Commonwealth can't do this. The Commonwealth can express a view, and they were expressing a view. But the states are the people who issue the medical orders, the health orders that make it compulsory. Last year, all states did that, and we virtually eliminated influenza from residential aged care last year. We think there is no argument why it should not also be compulsory in terms of COVID, which is a more dangerous disease, and which we know the elderly in residential care are the most vulnerable. And where do they get it from? They get it from as asymptomatic staff bringing it in to that home. So from our point of view, it's not an argument. You want to work in aged care, you get vaccinated. We didn't see lots of people leaving because they had to have the flu vaccine. And, you know, the Commonwealth has made clear that Pfizer is available to aged care workforce, so there should not be any reason for hesitancy.
And how is morale in the sector, and importantly among residents as well? Because every time we see a lockdown, visitors are stopped from visiting their elderly friends and family members. That's really got to be such a difficult time for so many Australians.
Well, you're absolutely right. And actually, well, we did see last year where the provider sector went overboard in that regard, or not all of them. Let's acknowledge that there are some very good providers who never closed except when they had to under a health order from the state or when they actually had a small outbreak. But many of them excessively closed doors, and every week we get reports of issues for residents and for families. Dealing with one now with a family member who's been going in 5 days a week to her mother, at least 5 days a week, and a key support person actually is also doubly vaccinated, and the home is saying that she can't come in. This kind of thing is unacceptable. There is actually a visitor code that we negotiated last year, and we'll be pursuing those kind of issues. But too little recognition was given, and has still been given in many cases, to the mental and health impacts of that degree of isolation, particularly amongst residents with dementia, where you can actually see irreversible progression of the disease due to the confusion and stress.